radio. We're a little informal here, Rose. This is just a conversation with me and my friends.
Okay, let me. Yeah, hi, friends.
Yeah, no, you're the friend.
I'm the friend.
Yeah, you're the
Yes, of
friend.
course.
Exactly. You're the friend
Lucky
for the day,
me.
Rose. Lucky you.
Lucky
Lucky
me
me.
to
Lucky
be.
us.
Yeah.
Yeah, I need you as a friend today. I was talking to Zay about what he's got planned for the weekend. Zay's got church stuff. He's got gospel singers coming in. I don't know how he puts up with me. A degenerate like me. I don't have any of that planned for the weekend. Welcome back, everybody. Capitalism Remix. It's good to have you. I can't wait to get started here, Rose. It's nice for you to do this. I'm really happy that we get a chance to sit down for a couple of minutes and just chat about all the great work you're doing.
Thank you. Thank you for having me.
Yeah. So let's just jump right in. I want you to give me a little bit of your background, not specifically about the company, 1104 Health. We're going to get into that. Specifically, I want to understand where that name comes from, but we'll talk about that in a minute. Just about your background, about how you became an entrepreneur and your path there. I would love to hear about that because I'm not sure that you and I have ever really talked about that. Ken Malone introduced us, and unfortunately for all of us, if Ken asked me to do something, I'm just likely to do it. So I didn't do all my KYC, AML when I first met you. I just said, well, Ken says you're okay. I think you're probably okay, but that's not great for a podcast. So give me a little background.
Well, as long as I stay okay, then you're
Yeah,
okay.
yeah.
Well, I'll give you my origin. The three acts of my life, the first two acts before we get to the third one, right?
Yep.
So I was born and raised in China. Shanghainese girl, grew up in Beijing. I attended college in Beijing, studied computer science, and minored in applied math. Then, 1989, I participated in Tiananmen Square as a student seeking democracy.
Wow.
And then in 1990, I was one of the first 100 Chinese students allowed to come to the US in July of 1990. So I landed in Texas and studied computer science as a master's in computer science, decided not to pursue a PhD. And then from there, so I was raised in a very engineering and scientific family. Both parents are academics. My mom, scientist, dad, an engineer. I grew up liking solving problems. That's my DNA. I just
Mm-hmm.
love solving problems.
Now let me hold on. When you say you were one of the first students, Chinese students, was that not ever? Do I have
Not
this
ever. No, no, no.
ever
It was after
after
Tiananmen Square.
after
Yeah.
Tiananmen Square? Okay, so after okay,
Yeah, yeah.
yeah.
The Tiananmen Square movement actually really impacted my life in a huge way, as you can imagine. Then after the crush on June 4th, in fact, we just had an anniversary. After crush in the square, the country went into martial law in Beijing, in China, and
Okay.
the diplomatic relation between the two countries kind of froze, and there were nobody going back and forth, where no students were allowed to travel. I was fortunate enough to have already obtained my passport, and all I had to do was wait till the US opened up again, allowing Chinese students to come. And in April of 1990, end of April, U.S. Congress passed the Chinese Students Protection Act. So
Mm-hmm.
I was one of the first beneficiaries of that act.
Okay. All right. Wow. Interesting. So that's Act One.
Yeah, Act One, just grew up in a academic family, love solving problems, always good at math and computer science coding, and just really enjoyed engineering. And I'll say how I got into my second act, which is entrepreneurial. Um, like after I got my master's, I worked, of course, with corporate America. My first job. Uh, Actually, before my first job, I worked as a campus consultant for Next Computers, which was Steve Jobs' company after he was forced out of Apple.
Yep.
And then later he had the bittersweetness of selling it to Apple. I met Steve Jobs, so I worked for Next for a year and a half before I got my real job, which was working for a big corporate America company. Then there was in telecom. Lots of changes in America then, early 90s, and I got recruited to work for a software startup called Lighthouse Design in Silicon Valley. I jumped at the chance. It was kind of the cool, really, really cool software companies, one of those early 90s that only nerds know about. And I was a nerd. I was an introverted nerd.
Okay.
I jumped at the chance, if you can imagine that.
Yeah.
I jumped at the chance and moved from Texas to California. And I was recruited to write a product they had imagined didn't know how to write. And we took it to beta in 6 months. I was the lead engineer on that product. A year and a half later, we sold for $50 million to Sun Microsystems. And with that, that triggered me going into the entrepreneurial act, which is act number 2.
Yep.
After
now,
the
now, where in Texas were you?
Houston.
And then
Yeah.
where did you end up in San Francisco, or?
Yeah, the Bay Area.
It was a little bit of a culture shock, I would imagine.
Oh, it was a big culture shock. It was a huge culture shock.
Yeah.
Many levels. Yeah. Well, think about a Chinese girl in Texas and then
that's
to California.
Exactly what I'm thinking about. A Chinese girl in Texas, and you were in like Texas. I go to Austin a lot, but Austin's not Texas. Austin
is not Texas.
Right. So you were in real Texas.
Yeah.
And then you ended up, y'all, a lot of y'all down there. And then you ended up in Silicon Valley in San Francisco.
Yeah.
Okay.
And that was a really interesting culture shock, and lots of not a lot of immigrants that I saw in my small circle of nerdy friends. We were just a bunch of nerds working 80 to 120 hours a week, slinging software.
Yeah.
And had, really cool, we had a chef that came in every morning cooking us a meal. We had masseuse twice a week.
What year was this?
This was 1993.
Okay.
Yeah.
So pretty heady days in San Francisco.
It was pretty heady days. Yeah. We sold in 96. And the defining moment for me was having a meeting with VP of HR at Sun Microsystems. And she had me in a small office and congratulated me and said, we had a 45-minute meeting. I remember this vividly. The whole time she referred to me as an engineer level 4. How lucky it was for me at age 27 with only a few years experience to be given this engineer level 4, which is a pay band. And of course, until that point, I never even heard of pay band. I didn't know what a pay band was. And she explained the whole thing, the options on top of the cash and stock and all of that. God, I was swimming in all of that jargon and thinking, the only thought I had was, wow, I'm not good enough to be an employee number. She couldn't refer to me as even a number. She never called me as Rose. She never referred to me as Miss Wang or any of that. I was engineer level 4 the whole time. So I walked out of that meeting determined, because I had been getting calls from recruiters, leaving messages on my phone and say, hey, you're famous. We want to get you some, we want to recruit you to work for Microsoft or whatever, right? I just returned one of those random calls, and that started my act number 2.
All right. So random calls returned by engineer level 4, and then where did that lead you?
It led me to opening up my own uh, consulting LLC. Um, it was it turned out to be a recruiter for MCI, so I'm dating myself.
Yeah.
MCI, so telecom was being deregulated, and they were trying to get into the local market. They were a long distance carrier, and so they wanted using technology to accelerate that market opportunity access. And so they were hiring. They had to pick the technology they were looking for engineers like me, uh, recruiting literally from all over the country to join them. I had one call. They made the offer on the spot, and I had the gumption to say no because at that point I said I'm fed up working for corporate America. you know, how much experience did I have?
Uh-huh.
Virtually nothing. I was just very ignorant. Said no,
And
and they were
here comes
shocked.
the entrepreneurial neural mindset.
Yeah, and they were shocked and said, "Uh, what do you have in mind, Ms. Wang?" I said, "I want to be a company. I don't want to be working for you full time. I want to be independent. I want to, be my own company." They're like, "Well, do you have a company? Do you actually have a legal entity?" I said, "I don't yet. Consider that done."
Uh-huh.
Hung up that call, called one of my friends who was practicing law, corporate law in New York, called her
Okay.
up. I said, "How do I become a company?"
Well, first you have to have an idea. No.
I had no idea. I just didn't want to work for a big
Yeah,
company
I
and,
do
and
have an
not good enough
idea. I
to be a
don't want to work
number.
for anybody else. Yeah,
Yeah,
sometimes
that was
that's
the
the only
idea.
idea you need. I don't want to work for anybody else.
Yeah, that was it. I was so certain I didn't want to work for anybody else. And I'm actually true to myself to this day. I have not worked for anybody else, only for myself.
Wow,
And so
congratulations. That's good.
thank you. Then so she said, "Go get this book called Ink Yourself. Read it,
Yeah.
and after you read it, let's have a conversation." I read it, of course. One weekend, called her back. I said, "I'm determined. What do I do? Pay me $500, I'll incorporate you." So that's how.
Yeah, there you go. So
Yeah,
the first business was a consulting practice?
yeah, just a
And,
consulting practice. Yeah.
and what sort of work were you doing?
Oh, anything that people would pay me to do. Uh,
Wow. Let's this is a family show, Rose, so not anything. Anything in the technology area, I'm
right,
assuming.
right, right.
Yeah.
Remember, I was a fully full-blooded nerd at the time.
Yeah.
So anything in terms from coding to running projects, to running requirements, to doing architecture, designing software, all, any of those services.
Hmm.
That's what I
And
did.
how long did that last?
That lasted until 1998. So only 2 years. I
Yep.
chased projects around the country, and it was really fun. But in 1998, if you remember, it was really internet was getting really heating up, and lots of ideas of portals, internet portals, and software. So a friend of mine asked me, this was successively, I had two startups then. A friend of mine that I work with, another coder, said, "Hey, a bunch of us are getting together. We want to repeat the lighthouse uh, successes you guys had. Why don't you join us?" And so I've worked with this guy, and when he introduced me to the other two co-founders, I'm like, "Oh, these are really smart people. We can do." And Java, which is another technology that's evolved out of Next, has really gotten to a point of enterprise. So we kind of put our heads together and say, we can do I did at Lighthouse, but better for this other we thought it was pretty straightforward. So started building another company, building another product, and but none of us knew how to run business.
Yeah, yeah.
So
See that a lot. Yeah.
none of us knew
A bunch of
anything.
engineers, right? What was the
Yeah.
product? What was the idea? Where did the idea come from?
The idea came from we're software developers, and there were no tools for us. And that was the product I wrote. The first product I wrote and became 15-minute fame was I wrote a software tool to help programmers design software graphically and then generate code.
Okay.
Yeah. And that whole product eventually got folded into the basics of Java Enterprise, Java 2 Enterprise Edition. So, but the product itself didn't live, as an independent product.
Yeah, yeah.
And
Okay.
now this second go around, we said, oh, there's so many things I didn't do right in the first product. Let's do it right. And, not only we can do the graphical programming and generating code, we connect to databases, that we can, generate different types of code. We can integrate with other platforms. So that was our idea. And based on that, it was a second iteration of something that was successful. We raised some money and found a CEO. Basically, the CEO came with some money. I wasn't involved in raising money. I was the chief architect, so I was architecting this product. I was really nerding out. And one of the co-founders, actually, he went out and raised some money, and this one guy gave us money, and it was a condition was they will give us a CEO. The CEO came, and we were always a month away from going out of business because we just never had enough money. And so he would always come around and say, hey, who wants to get more options? And
Who wants to work for
which
free?
who wants to work for free? Basically, who wants to give up your salary for more options? I raised my hands a couple times and finally just something is not right
Yeah.
about this every month, right? Meanwhile, he was, and I, because of the position I held, I traveled with him quite a bit and the sales team, and I saw how lavishly he was spending, and so, anyways, that
Well,
was not.
and that was going to be my question. So, why do you think you were a month away from running the business? Was it because of that? Was it because, oftentimes I say that most startups go to business because they built something that nobody wanted. It's not always the case, but it's often the case. So, do you think that did you have the pulse of the customer?
We were selling to individual developers and actually bigger tech companies that needed to have a tool like that. The B2C part really didn't take off at all, right? The individual developers were not used to paying for software licenses.
Right.
It's the B2B part that that took a long time to take off. It never did take off.
Yeah. Okay. Why do you think that is?
Um,
In hindsight, what do you see?
in hindsight, we should have integrated with the big enterprise players much sooner.
Yep.
Yeah. And what I did was I basically played the consultant role as well. I got placed, I would go on like a month-long trip to Laguna Beach, California, working with Unisys, which at the time had this huge software platform that I did the integration there. And there was not a team behind me. So I could only go so far and so fast. If we had led with that, I think we would have had the chance.
I gotcha. So, I don't want to shortcut the story, but now here we are. We sit today. You're the CEO of 1104 Health. Talk to us a little bit about first of all, where did that name come from?
November 4th, 2019, I lost my husband to cancer.
Okay. I see. I knew that I would learn something new today. I didn't know that that's where the name came from. So, look, I know a little bit about your husband's story, not a whole lot, but what, it's sort of, it's definitely, integral to your business. So I don't
Very much
know
so.
what you want to like to tell us about that, and maybe more importantly, maybe what you want to tell us about him.
Oh, he was American hero. He was a patriot. He's an army veteran
Yeah.
and well known in the military space. He retired from the army as the chief integration officer for the networks. So he ran their cyber operations,
Mm-hmm.
and then became a vice president at Gartner Research. And
Okay.
he retired from Gartner actually, uh, before he got sick. He had already retired from Gartner and started his own consulting practice. Um, so he was diagnosed at the beginning of 2019. And our story, our journey is very much the origin of 1104 Health because of what we experienced. We got on treatment within 2 weeks, like 50% of cancer patients in the US. We also started our diagnostic and treatment journey in the community. What I mean by that is community is where a lot of private practices as well as regional hospitals, those treatment settings or healthcare delivery settings are called the community setting.
Mm-hmm.
The contrast is academic setting. So your academic setting would be Johns Hopkins, NCI, National Cancer Institute, or Georgetown Lombardi. Or University of Maryland.
Yep.
Those are the NCI designated. The highest level of care for cancer patients are those NCI designated comprehensive centers. So we did the typical cancer patient thing, got diagnosed in the community, started treatment process in the community, and wanted to get treatment right away. And we did jump on it without much, any real homework done.
Yeah.
And he was at diagnosis, he was already metastatic, his cancer. And so we just want to get treated right away. And then what happened was he, failed the first line of treatment. A doctor moved him on to the second line of treatment, and then he failed that one. At that point, we sought a second opinion and third opinion, but second opinion at an academic center. Within 15 minutes of that second opinion visit, we learned we had missed a big opportunity, which at the time we didn't know. And then after he passed, and now the work I'm doing, it was one of the landmark clinical trials that has changed the way cancer care is defined.
So that
It's
was the opportunity you missed.
It was the opportunity we missed. Yeah, he would have been eligible if he hadn't started treatment. They call them treatment naive patients would have been eligible, but because we started treatment right away and 6 months later we weren't eligible anymore. So that seared in my mind from
Yep.
that visit.
So
Uh,
tell us about so how did that, then that's now turned into 1104 Health. So tell
yes.
everyone what 1104 Health is, what it does.
So 1104 Health. So I wanted to fix the fragmented care problem, right? The opportunity we missed was the symptom. It's a symptom. So I wanted to get to the root cause of the symptom,
Mm-hmm.
and did a lot of literature research and found, even today, patients still have that problem. And an easy conclusion would have been, oh, if we had just gone to an academic center from the start, maybe we won't miss it. Uh, no, that is actually not the absolute case. Only 7% of US cancer patients enroll in clinical trials, despite 30 years of investment from pharmaceutical companies, from technology companies investing in clinical trial technologies and patient recruitment technologies. That number, that 7%, has not changed much. 10 years ago was 3 to 5%. In 10 years, we haven't moved much of the needle. And meanwhile, innovation is moving really, really fast. There are over 3,000 active clinical trials for oncology patients. 45% of US cancer patients are eligible for trials. So you have to ask the question, you have to beg, why, right? Why there are only 7% patients enrolled despite up to 45% eligible, and millions and millions of dollars of investment, lots of CROs, clinical research organizations doing this work, why the needle hasn't been moved? The answer, and it's still not the root cause, the answer is 85% of patients get treated in the community setting and they never seek second opinions, or even if they seek second opinions, they still, they trust their physicians in the community because they're convenient, very accessible, and they're affordable. And that's where the problem exists, persists, that need to be solved. And then I looked further, it's community oncology and academic oncology operate in complete silos. They don't know what's going on with each other, and they hate referring patients to each other.
Which seems crazy, but
yeah, they don't cooperate. They don't collaborate.
Right.
I hear story after story of we want to crush you one side to the other in different markets.
Yeah. So how do you solve that?
So we're building a digital health infrastructure. We're a digital health infrastructure company. We're building a digital platform to power a shared care network. So we're basically promoting a new model called shared care to take basically best of both worlds and facilitate and help these doctors in two different groups build trust, build relationships, actually collaborate with each other. So it's called shared care. This technology itself, think of it as a super app for doctors, for credentialed oncologists to get on and chat with each other in real time. And then these chats, they call them curbside consults, eventually turn into referrals to clinical trials, referrals to advanced therapy options, or just getting some complex questions answered. That's the fastest way to solve a patient problem. And
so it's sort of like the wisdom of the crowds in some way, right?
yeah.
But it seems to me, how do you overcome the cultural issue, right? I mean, if I want to crush you, I want to crush you whether I have an app that lets me cooperate or not. So how are you overcoming what seems to me to be like as much a cultural issue as it is a access or technology issue?
Very, very true. So with just like change management, I've been in technology, using technology to transform business all my life, right? Change management needs to identify a number of things. Champions, so clinical champions, people who believe this, you start with them. And then once you create a critical mass, then you go to the business side, leadership. And that's when change could really happen. And I'm seeing that with my own eyes in our area, in the Mid-Atlantic area. We launched the platform late last year with a couple of doctors who believe in this, couple in Hopkins, couple in community. Now we have over 500.
Wow.
Over 500 oncologists, and get this, Johns Hopkins, University of Maryland, Georgetown Lombardi, all of MedStar Health, The largest private practice in Maryland, Maryland Oncology, Hematology, and Kaiser.
Yeah, that's amazing.
6 months.
In 6 months. That
Yeah,
was going to be my next question. How's it going?
it's going insane.
Yeah,
It's insane. It's
yeah.
insane, but it's great.
Um, it's really an amazing story, Rose, and I'm so grateful, one, to Ken for introducing us, and you know, sometimes with all the stuff that's going on with us, it's hard to, we got a lot of inbound, right?
Yeah.
So I'm grateful to Ken for to introducing us, and also grateful to you for the firm but graceful way that you stayed in contact. So I was able to sort of really get my head around what you're doing. So I'm really, really thankful to the both of you. Let me ask you a little bit of a different question. So it seems to be going really well. We're going to get to sort of what's most pressing for you right now and what are you most proud of. But before I get there, um, how is the current environment medical driven by political? Because I think that there's some chaos. Science be damned in our political environment right now, and with money moving away from many and many of the most critical areas. How is that impacting you? What are you seeing there?
Interestingly, I haven't seen any impact, negative
Okay.
or positive. I hear a lot of noise, and that's what I just ignore it. I'm sort of in that business of ignoring the noise and only deliver the news. And when we deliver, my team is doing an amazing job delivering it. Um, I think we see more believers like you. I want to say I'm very grateful to you, Jeff, for believing in what we're doing. When you invested, we had, you know, just a little more than an idea, right? We hadn't really
Yeah.
launched the platform. So concrete impact, yes, we do see that. As we're not partnered with the government. We're partnered with pharmaceutical companies. Um, and this is in this area, it's a good thing, right? Because they
Mm-hmm.
are focused on making profit and want to continue to push forward. Yes, everybody complains, but we can pretty much cut through the noise. We're not partnered with government. However, because we're a company that is mission driven, we do work we do refer patients to National Cancer Institute
Mm-hmm.
for government trials. In that we have seen an impact there. The staff members there don't return calls, don't respond to emails, and patients are left languishing because we refer. Just a couple weeks ago, we had a patient, pancreatic cancer, metastatic. We found a perfect match for them at NCI, and
Mm-hmm.
nobody would return our call. I had to turn to one of our advisory board members who used to be a high up, former ASCO president, Dr. Bruce Johnson. I said, can you help? He went all the way to the very top of NCI's clinic, CMO, to shake that loose.
It's
That
a
took two
shame.
weeks.
Yeah,
It's a
it's a,
total
right.
shame. Total shame.
And
Yeah.
and sometimes we don't have 2 weeks to wait, right?
No.
But
Yeah.
look, I mean, from your response that how you're grateful to us. Look, you're sort of like the perfect entrepreneur for us, right? Because we want to do things that actually change people's lives, right? We think about what's our role as venture capitalists? Well, it's to invest in the world we want, in the future we want to see, right? And as you know, I'm very, very focused on the cure for cancer. I want to see that. I
So
want
am
to see
I.
that.
Yeah.
Yeah, both of us want to see that happen. So this is I know that this is going to be you're going to be one of our major success stories. So I'm so just thrilled to be in this with you, and I'm glad. Other than a story like that, which we've got to fight against, that you're not seeing too much, detrimental issues happening because of the politics of the day, right?
Yeah.
To talk a little bit about, just real quickly, I want to double click on one thing you said about your customer is actually the pharmaceutical company. Is that
Yes.
correct? So
Correct.
talk a little bit about that. How does that work? How that works?
Yes. So pharmaceutical companies, they sponsor clinical research, and they basically take new agents, new molecules, and go through human testing, phase 1, phase 2, phase 3 trials, and then going for FDA approval. And they run in oncology 3,300 active oncology trials. About 2,000 of them are sponsored by pharmaceutical companies, and when they sponsor a trial, they have to pick research centers where they run them. So what we do is we contract with pharmaceutical companies who have those trials, and they basically pay us when we have patients, eligible patients, enroll in their trials and start treatment. That's how our business model works.
Okay.
And they also pay us for additional services. We have a second use case I'm happy to share with you in real time, to access our network. Now that we have, a few hundred, right, 500 and more, and we're growing that every day, so that we can play the role of educating these community oncologists. And that is very critical. It's a part of a virtuous cycle, meaning community oncologists, they are generalists. They see all types of cancer patients, and they see between 30 to 40 patients a day. So it's very difficult. They have no time. These doctors are so dedicated to patients' well-being. They would start their clinic a lot of times at 7 in the morning and won't end. They won't go home until 7 at night, and oftentimes have to come in on weekends, even to open another half day of clinic just to get through all the patients. Again, 85% of patients are seen in the community. So these doctors are super smart and super good, super quick in solving general problems, but they don't have time to do the clinical trials a lot of times, right? It's just a lot of information to download, and making sure a patient is perfectly matched and can still get to a trial, may not be at their center, maybe at a different center. All of those we take care of on our platform. We use AI to give them, we have quotes, testimonials from these doctors. It's cutting the time they spend on patients looking for trials by 75% of time.
Yep.
Yeah.
So cutting the time, connecting the patients to doctors, to trials they might not know about, and then also connecting the local doctors, the community doctors, to the cancer academic and cancer center doctors, so they can exchange information.
Correct. They can exchange information, and then the academic doctor can transfer. Like, say, the academic ones only see pancreatic cancer. They don't see, breast cancer at the same time. So they can get deep. They are on top of the latest innovations. So then, we have you get that, right? So now we have two use cases. Both are funded by pharmaceutical companies, because it's in the pharmaceutical company's best interest to also educate the general oncologist that, hey, there's for instance, in 2024 alone, there are 60 newly approved cancer treatments.
Yeah. Wow. I have a very good friend in New York who once told me, Jeff, we were talking about, should you go to the person who developed the protocol or someone who studied the protocol? And he's always like, you want to go to the guy who created the thing, right? Which a little bit talks about what you're saying. If someone is a specialist, they can transfer that knowledge. But he once told me, he said, Jeff, there's a worse doctor in the world somewhere, and tomorrow somebody's got an appointment with him. And you don't want that to be you. right? So
Yes,
this is, maybe we can, get some, that knowledge transfer is really important.
it's
That's
critical.
my way of saying that.
Yeah, it's so totally critical. Yes, that's a
Yeah.
good one.
So, Rose, what's most pressing for you right now?
Fundraising.
Okay. Yeah.
Not surprising, right?
Not
Um,
surprising.
yeah, so we got this going. We're revenue generating. We have lots of great things happening, and we've been super lean, which I don't regret at all.
Yeah.
I think being lean is a good way to force us to focus and make the right choices. And so far, we haven't deviated too much, or we haven't been led down the wrong path too often, I should say. Um, but we still need capital. So I'm in the middle of raising another round of financing,
Yeah.
and I've had some successes. Maryland Innovation Initiatives is giving us a chunk of money. Blackbird Labs in Baltimore, they wrote a check to us as well, and a couple other angels.
That's good.
So yeah, so we're just on the fundraising slog. That's one of my biggest challenges right
All
now.
right. Well, we can talk about that offline. If anybody out there who's listening to this is interested in what Rose is doing, here's the best thing to do: reach out to me. Reach out to me, jcherry at cvpartners.vc, so we don't get into any unsolicited, any Reg D problems here on our podcast. So they can reach out to me, and I can determine whether they're accredited investors, and we can do something with them, and then I can introduce them to you. But Rose, you and I should talk about that offline as well, okay?
That'd be great. Yeah.
Yeah. The correlated question: what are you most proud of?
I'm most proud of the team I have built so far.
Yep.
Um, you heard my origin story. I'm just an engineer loving to solve problems, putting together puzzles, but had no prior medical healthcare background at all.
Yeah.
Zero. I was cancer naive and healthcare naive. But the team I have, so far has been great. The founding team, I have 5 members of the team, all have had prior exits in health tech. And I just recruited a community doctor who's been really advising us for free for a year to become our chief medical officer.
Wow.
Yeah. And rounding that team are these super engaged academic doctors from Hopkins and from Dana-Farber. And I just added another doctor from military. So I think we have a really, really fantastic team. I'm really proud that I've assembled, and everybody just got this same mission. How do we get more patients equitable access to clinical trials and advanced therapeutics at the right time, at the right cost? So cost is another piece of the equation. I'm hoping to add to the customer list payers, value-based payers specifically. We're exploring that with, in a number of different angles, but I think employers large employers who have self-funded benefits plans would be very interested in working with us.
Okay. So that goes to my next question. I think you've answered. How can the audience help? So payers, large employers.
Yeah, if anybody, I've been trying as heck to get to Care First in Maryland. I've talked to a
Okay.
number of yeah, I've talked to a number of people at conferences. They're super busy. I have not gotten a call back yet, so I'm not giving up.
All right. Come on, Brian Pennick. Brian, if you're listening to this podcast, get in touch with me. We need to put you and Rose together, okay? And all of you others who are listening, you know Brian. He's the CEO of Care First. He's a friend. We need to get him connected to Rose, so I can work on that too. Rose, this has been fantastic. I love talking to you. I love seeing you out and about. Saw you at the Techstars demo day a couple of weeks ago. Are you going to be able to come to the Conscious Venture Lab demo day on Tuesday?
This coming Tuesday?
Yeah.
I'm sorry, I can't make it. It's not on my calendar.
Oh, that's all right.
Darn.
That's
Next
all
time.
right. Next time.
Yeah.
We got to make sure we get you on the mailing list. I don't know what's going on there. But Zay, I put the website address and Rose's LinkedIn in the chat, so we'll get those on the show notes. This 45 minutes always goes by so fast when we're having such fun like this.
Yeah, it flew
But
by.
I have one
Wow.
more. I have one more question though.
Okay.
We end every show with the same question, and we're putting together a playlist. So you got to contribute to the playlist. So if you
Okay.
were stuck on a desert island and you only had 3, you can choose 3 or 5. I've been very generous lately. 3 or 5. It could be songs or albums that you must have if you were stuck on a desert island. What would they be?
Karen Carpenter songs.
All right. That's good. We'll start there. That's only one though.
Oh, these are my how I grew up. That's how I learned English, by listening to Carpenters and Michael Jackson songs.
Karen Carpenter, Michael Jackson, or any specific songs?
Oh gosh, all of them. Whatever I got my hands onto, that's what I listened to. Remember, I grew up in communist China in the 70s and 80s. Very little access to.
All right.
I love learning English, so
all right.
that's how I learned English.
Then I'll tell you what, Zay and I will pick your songs. We'll look at Karen Carpenter and Michael Jackson. We'll pick a song. We'll pick a couple of songs for you to add to the list. All right. I should have told you this beforehand so you could prepare. But
Yeah.
I like to see people's reaction when I ask them at the end. No,
That's
I
a
don't.
good one.
People should be they should be listening to the podcast to be prepared for this. All right. Well, here we are again. You've wasted another perfectly useful 47 minutes listening to me, but not wasted listening to you, Rose. Fantastic. You're doing amazing work. We love being part of your team and here to help as much as we can. So everybody out there, thanks for listening. This is Capitalism Remix. We will be back whenever Zay decides we're coming back on, probably next week. All right.
Thank you so much for having me. It's great fun.
See ya. All right. Thank
Bye.
you.